Our next speaker is Dr. Rozen. He's a professor in neurology. He's did his residency at Mayo Clinic and then did a fellowship in Philadelphia, joined the group there for a headache center, went to Cleveland Clinic for a headache center, and then went to Michigan Head and Pain Center, was director there, and now we're fortunate he's with us. He's got over 100 publications, 2 books, and has done an amazing job here at Mayo Clinic with headaches. With that, I'll turn it over to Dr. Rozen, and we'll learn more about headaches.
Good morning. Thank you for asking me. We're going to do a quick update on migraine pathogenesis, our current understanding. We're not going to delve a lot into treatment just because of time, but happy to do so in the question and answer period. I don't have any disclosures. Okay, so what we may not recognize is that migraine is not just headache. Migraine is actually made up of phases. Not every migraineur has each phase. And the phases of migraine are the prodrome, the aura, the headache phase, and the postdrome. But all these individual phases have their own distinct pathogenesis and actually their own unique treatment. And over the years, we're learning more and more about this pathogenesis, and hopefully by the end of the talk, you'll recognize we actually understand more about migraine than we do about most neurologic illnesses. So the migraine prodrome is something we probably have heard the least about. This is the phase of migraine that actually can occur in upwards of 60+% of migraineurs. There was an electronic diary study that we did back when I was in Philly that showed that the prodrome can actually start anywhere from 6+ hours up to 72 hours before the onset of migraine. The prodrome symptoms can be very general. I just don't feel well. They can be truly psychologic or psychiatric. You can get euphoric or very depressed during this time. They can be GI or GU. You can get very constipated or have urinary retention, and then after the migraine is over during the postdrome, you can get diarrhea or diuresis. The 2 symptoms, though, I would focus on, the ones that have really honed into the causation of this phase, is 1, yawning. Now, the yawning here is a status yawn. This is not a tired yawn. I can't stop yawning. And yawning is a hyperdopaminergic response. If you give apomorphine, which is a dopamine agonist, to migraineurs, they're much more likely to yawn and get nauseous than non-migraineurs. The other one is food cravings. Migraineurs crave what? Chocolate. Chocolate actually does not cause migraine. There have been studies using GIBLIB as basically a placebo during this phase that actually